Today we're going to be discussing the endocrine system. This information can be found in chapters 10 and 50 of your textbook. The first couple of slides are the medical terminology related to the endocrine system. What is the endocrine system? The endocrine system is made up of glands called endocrine glands. The endocrine glands secrete chemical substances called hormones into the bloodstream. Hormones regulate the activities of other organs and glands in the body. The endocrine system helps regulate growth, reproduction, use of nutrients by cells, salt and fluid balance, metabolic rate, and helps us respond to stress. The endocrine system works with the nervous system to maintain homeostasis. Certain neurons, called neuroendocrine cells, are an important link between the nervous and endocrine systems. Neuroendocrine cells produce neurohormones that are transmitted down axons and released into the interstitial fluid. They typically diffuse into the capillaries and are transported by the blood. Some local regulators, chemical messengers that act on nearby cells, are also considered hormones. Prostaglandins are a group of about 16 closely related lipids that are manufactured by many different tissues in the body. Prostaglandins interact with other hormones to regulate various metabolic activities. Some prostaglandins dilate the respiratory passages, inhibit secretion in the stomach, or cause inflammation. For example, aspirin reduces fever by blocking the production of certain prostaglandins. This picture shows the various endocrine glands in the body and their location. Endocrine glands do not have ducts. They release their hormones into the surrounding interstitial fluid or into the blood. Hormones are typically transported by blood. They affect the activity of their target cells, which are the specific cells on which they act. Target cells may be located in another endocrine gland or in an entirely different organ. Specialized proteins on or in the target cells are receptors that bind with the hormone molecules. The receptor is like a lock and the hormone is like a key. Only the hormone that fits the lock can influence the metabolic machinery of the cell. The body maintains homeostasis using negative feedback loops. Homeostasis depends on normal concentration of hormones in the blood and tissues. Hormone secretion is regulated by negative feedback systems, neuroendocrine regulation, which is the action of both the nervous and endocrine system, and biological rhythm, which rhythmic changes in a hormone's rate of secretion. The circadian rhythm is an internal rhythm that follows the 24-hour day sleep-wake cycle. Cortisol secretion is greatest in the morning before an individual gets up. It then decreases throughout the day, reaching its lowest concentration at bedtime. When levels of a particular hormone are too high, the gland will stop secreting it. In a typical negative feedback system, information about the amount of hormone in the blood or interstitial fluid is fed back to the endocrine gland. If the hormone concentration is too high or too low, the endocrine gland responds to restore homeostasis. For example, the parathyroid glands regulate the calcium concentration in the blood. When the calcium concentration is not within homeostatic limits, nerves and muscles cannot function properly. When calcium concentration varies too far from the steady state, negative feedback mechanisms bring the condition back to steady state. Hyposecretion is when the gland decreases its hormone output to abnormally low levels. Hypersecretion is when a gland increases its output to abnormally high levels, overstimulating target cells. So for instance, insulin, which is a hormone, if there's hyposecretion, you would have diabetes mellitus. If you have hypersecretion, you'd have hypoglycemia, or low blood sugar. Positive feedback loops cause greater and greater amounts of hormone to be released. The hypothalamus links the nervous and endocrine systems. Directly or indirectly, the hypothalamus regulates most endocrine activity. It controls the brainstem and the spinal cord. It's the center of emotional response. It regulates body temperature, regulates food intake and controls thirst, and controls pituitary and many other glands. The hypothalamus produces pituitary-stimulating hormones and controls the pituitary, allowing for regulation of body temperature, hunger, thirst, sleep, and wake cycles. The pituitary gland is a small, cherry-sized gland at the base of the brain behind the eyes. It is regulated by the pituitary gland. The pituitary gland controls many hormones that regulate growth, development, and the function of male and female reproductive systems. The anterior lobe of the pituitary gland also secretes several tropic hormones, or hormones that stimulate other endocrine glands. The anterior lobe secretes growth hormone, which stimulates the growth of muscles, bones, and organs, thyroid stimulating hormone, which stimulates thyroid gland function, adrenocorticotropic hormone, which stimulates adrenal gland function, melanocyte stimulating hormone, which stimulates melanocytes to produce melanin, prolactin, which stimulates the production of breast milk, and luteinizing hormone and follicle stimulating hormone, which stimulates the release of sex hormones and gamete production. Each of the anterior pituitary hormones is regulated in some way by a releasing hormone, and in some cases also by an inhibiting hormone produced in the hypothalamus. These neurohormones enter capillaries and pass through special portal veins that connect the hypothalamus and the anterior lobe of the pituitary. Within the anterior lobe of the pituitary, the portal veins divide into a second set of capillaries. The releasing and inhibiting hormones pass through the walls of these capillaries and into the tissue of the anterior lobe. Portal veins do not deliver blood to a larger vein directly. They connect two sets of capillaries. So for instance, prolactin stimulates cells of the mammary glands to secrete milk. Prolactin secretion increases when the nipple is stimulated by a nursing baby. The tropic hormones are TSH, stimulates the thyroid gland, ACTH, which stimulates the adrenal cortex, the gonadotropic hormones, follicle stimulating hormone, and luteinizing hormone, which control the activities of the gonads. Next, we have the posterior pituitary lobe, which secretes antidiuretic hormone, which prevents the kidneys from excreting too much water, and oxytocin, which causes uterine contractions during childbirth. The thyroid gland is a butterfly-shaped gland in the neck below the larynx. Thyroid hormone. Thyroid hormone regulates metabolism, or how the body uses nutrients to provide energy and maintain body functions. The thyroid gland produces calcitonin, which reduces calcium levels in the blood. Too little thyroid hormone causes slow body processes, slow movement, and weight gain. Too much thyroid hormone increases metabolism, excess energy, and will cause weight loss. Hypothyroidism is an underactive thyroid. It occurs when the thyroid gland does not produce enough thyroid hormone. Signs and symptoms include fatigue, weakness, weight gain, constipation, intolerance of cold, dry skin, brittle hair and fingernails, lowered blood pressure and body temperature, hoarse voice, depression, and goiter. A goiter is an enlarged thyroid. Hyperthyroidism occurs when the thyroid gland produces too much thyroid hormone. Body processes speed up and metabolism increases. Signs and symptoms include nervousness, restlessness, fatigue, bulging or protruding eyes, tremors of the hands, intolerance of heat, excessive perspiration, tachycardia, hypertension, increased appetite with weight loss, and goiter. There are 4 parathyroid glands. 2 lie on each side of the thyroid gland, and parathyroid hormone regulates calcium use. Calcium is needed for nerve and muscle function and to prevent tetany, which is the state of severe muscle contraction and spasm that can lead to death. The parathyroid glands are regulated by the concentration of calcium in the blood and tissue fluid. When calcium concentration rises above normal, the parathyroid glands slow their secretion of parathyroid hormone. When the calcium concentrations become very high, calcitonin is released from the thyroid gland. This hormone quickly inhibits removal of calcium from bone. When the concentration of calcium in the tissue falls even slightly, parathyroid hormone secretion increases. When parathyroid hormone secretion is too low, calcium concentration falls. Nerve fibers become more excitable and may discharge spontaneously. This causes muscles to twitch and to go into spasms, a condition called tetany. Too much parathyroid hormone results in too much calcium being removed from the bones. The pineal gland secretes melatonin. Melatonin is the hormone that regulates sleep and wake cycles based on the presence of environmental light. The thymus is a gland in the upper chest behind the sternum. It produces thymosin, which is needed for the development and function of the immune system. The pancreas is a gland in the abdomen behind the stomach. It produces insulin. The pancreas has both exocrine and endocrine functions. Its exocrine cells produce digestive enzymes. More than 1 million small clusters of cells, known as the islets of Langerhans, are scattered throughout the pancreas. About 70% of the islet cells are beta cells that produce the hormone insulin. Alpha cells secrete the hormone glucagon. Insulin regulates the amount of sugar in the blood available for use by the cells. Without insulin, sugar cannot enter the cells. Diabetes occurs when excess sugar builds up in the blood. Insulin is the hormone that lowers blood glucose levels. Glucagon is the hormone that raises blood glucose levels. Secretion of insulin and glucagon is directly controlled by the blood glucose level. After a meal, the concentration of glucose in the blood rises. This stimulates the beta cells to increase insulin secretion. Then, as the cells remove glucose from the body, the glucose concentration decreases. Insulin secretion decreases accordingly. There are 3 types of diabetes: type 1 diabetes, type 2, and gestational diabetes. With diabetes, the body cannot produce or use insulin properly. Without any or enough insulin, sugar builds up in the blood. Blood glucose, or sugar, is high, and cells do not have enough sugar for energy and cannot function. Type 1 diabetes occurs most often in children and young adults, but can develop in adults. The pancreas makes no insulin. Too much glucose stays in the blood. Onset is rapid. With type 2 diabetes, the body does not make enough insulin or use insulin well. This is the most common type of diabetes that can occur at any age, including childhood. Risk factors include being over 45, having a family history of diabetes, being overweight, and being physically inactive. Gestational diabetes develops during pregnancy. This type usually goes away after the baby is born. However, the mother is at risk for type 2 diabetes later in life. Type 1 diabetes is treated with daily insulin therapy, healthy eating, and exercise. Type 2 diabetes is treated with healthy eating, exercise, weight loss, and oral or injectable medications. Complications of diabetes include heart disease, stroke, kidney disease, eye problems, and nerve damage. Some signs and symptoms of diabetes include being very thirsty, frequent urination, feeling very hungry or tired, weight loss without trying, wounds that heal slowly, dry, itchy skin, tingling or loss of feeling in the feet, and blurred vision. Hypoglycemia is low blood sugar. Causes include too much insulin or diabetic medications, increased exercise, skipping or delaying meals, eating too little food, vomiting, or drinking alcohol. Signs and symptoms are shaky or jitteriness, sweaty, hunger, headache, blurred vision, fatigue, dizziness, disorientation, uncoordinated movements, irritability, weakness, rapid irregular heartbeat. The severe signs and symptoms include not being able to eat or drink, seizures, or unconsciousness. Hyperglycemia is high blood sugar. Causes include not enough insulin or diabetic medications, eating too much food, too little exercise, emotional stress, infection or sickness, and undiagnosed diabetes. Early signs and symptoms are frequent urination, increased thirst, blurred vision, fatigue, headache, and hunger. Late signs and symptoms are weakness, dry mouth, shortness of breath, nausea, vomiting, confusion, abdominal pain, and coma. The adrenal glands are located on top of each kidney. Each gland has two parts, the adrenal medulla, or the inner part, and the adrenal cortex, the outer part. The adrenal medulla is called the emergency gland of the body because it prepares us to cope with threatening situations. It produces epinephrine and norepinephrine. These stimulate the body to quickly produce energy during emergencies. It's the fight or flight response. The adrenal cortex secretes glucocorticoids, mineralocorticoids, and small amounts of male and female sex hormones. Glucocorticoids regulate metabolism of carbohydrates and control the body's response to stress and inflammation. Mineralocorticoids regulate the amount of salt and water absorbed and lost by the kidneys. The adrenal glands are also involved in regulating blood pressure. The gonads, for males, it's the testes, and that produces testosterone, which causes maturation of reproductive organs and secondary sex characteristics. The ovaries are the female sex glands, and they produce estrogen and progesterone, which cause maturation of sex organs and regulate the menstrual cycle. Some age-related changes to the endocrine system include levels of hormones decrease, levels of insulin decrease, and the body handles stress less effectively. Menopause also occurs in women. Menopause is the point in time 12 months after the woman's last period. It occurs due to a natural decline in reproductive hormones.